Today I'd like to talk about, does barbell training and do elite powerlifters have restrictions in range of motion? So does lifting a lot make you tighter? And one of the things this study found was there were some small changes in restrictions and some tightness between powerlifters and the normal population, but it was not very drastic. And just training alone in general does not usually make you tighter or cause you to lose range of motion. The study looked at upper body and lower body and compared powerlifters who were very elite to healthy controls or the normal population. And so what they found in the beginning, or the negative of the study, was looking at the upper body, they did find that shoulder flexion or lifting your arm straight over your head was tighter. So was extending your arm and internal and external rotation of the arm. So those are very important in baseball and softball. And less shoulder flexion actually has been shown to increase injury risk, as well as in softball. However, these range of motion differences were relatively small, and knowing them and knowing what can happen if you're lifting like a power lifter, then you can help treat this. Now, one thing is these power lifters were shown to be lifting about 5 days a week, heavy barbell training each day, and the bench press, the squat, and the deadlift were 80% of the exercises they did. So they're doing pretty much just these three exercises with their training, and they're modifying the weight, they're modifying how fast they're lifting it, they're modifying whether they're using chains or things like that. So they're really only doing bench press, squat, and deadlift. And one of the positives of the study, while they did have some limitations in the upper body, the lower body really had no significant differences between normal people and these power lifters. So this test looks at hip extension range of motion, and there was really no difference between the two groups in hip flexion, hip extension, and a lot of the lower body joint tests that they gave them for range of motion. In fact, the ankle joint was actually more flexible or more mobile in the power lifters, you can see here. So they're able to push down a farther range of motion, and then lifting their foot up, the dorsiflexion was very similar between the two groups. So one important thing also this study looked at was they then compared the quality of the power lifter, and they looked at low, intermediate, and strong power lifters. And they found that the ones that were pretty good power lifters but not the best really did not have much of a difference between range of motion between the controls and themselves. So only the elite power lifters really had more drastic range of motion differences. And one interesting thing is these less elite powerlifters actually lifted more than the elite powerlifters. So lifting alone, more barbell training alone, did not cause the difference in range of motion, because there are very small differences between the two groups here, between the normal population and the less elite powerlifters. So all in all, you can definitely incorporate the bench press, the squat, and the deadlift, and they should be, some of them should be very staple or main lifts in your programs. It's helpful to understand which range of motions or which joints may be affected or become tighter, such as shoulder flexion, shoulder extension, internal and external rotation. And incorporating that as well will be very beneficial. But all in all, most athletes are not training or specializing in these three lifts like a power lifter would be. They spend 80% of their training focusing on these lifts. And most athletes have a lot more rounded or well-rounded program, so they would not expect range of motion changes like this or stiffness. So it's very important to keep in mind that, and it's not always true that more lifting causes you to become tighter. In fact, like we saw, the lower body was actually more flexible and more mobile in elite athletes than just a normal healthy population.